Okay, so as it's a few minutes past three, I think I'll just 3 minutes past 10. Shall I just start off?
Yeah,
Okay, so this is just to let people know. Obviously, this is recording. I don't know if we've got any other attendees other than us at the moment, but so we are recording. If anyone else joins, I'll try and remember to chip in and let people know again. So my name is Catherine Pendergrass. I am the program lead for this program, and I'm joined by my colleague Sharon Furtado. Do you want to say hi, Sharon, and introduce yourself, or shall I do for you?
yeah, happy to. Hello, everybody. Catherine, just to say quickly, I can't see anyone in the attendee list, so I'm not sure if anyone's joined yet. But do you want me to, anyways, continue?
I think probably just as it's recorded, I guess it will go onto the program page. So yeah.
Sure. Yeah, hello, everybody. Good morning. I'm Dr. Sharon Furtado. I'm a senior sarcoma research physiotherapist from the Royal National Orthopedic Hospital. I've got experience with basically clinical and research experience in how to conduct research in the clinical environments. A physiotherapist by background, so we work a lot with orthopedic surgeries and also with other sort of musculoskeletal conditions. And we're currently developing a large program of work at the Royal National Orthopedic Hospital. Um, I co-lead the program with Catherine, so really here to help you all with any information you'll need, from a clinical point of view, for the program, for the physiotherapy program, and physical therapy program, sorry, and any questions you might have, if you all might want to email us as well. But yeah, happy to pass it over to Catherine, and if you want to add anything, Catherine.
Brilliant. Thanks, Sharon. As Sharon was saying, we co-lead the program. I'm sorry, the slide says just me, but it's both of us. So we co-lead the program. The program title is Physical Therapy and Musculoskeletal Healthcare and Rehabilitation. And it's a master's program that runs out of the Department of Orthopaedics and Musculoskeletal Science, which is based at the Royal National Orthopaedic Hospital out in Stanmore. I've worked in Stanmore for over 20 years and I'm an associate professor there. My main interests in research are in soft tissue biology and amputation prosthetics. However, I do lots of work across the physiotherapy programs and do a lot of research with Sharon as well in conjunction. So hopefully we'll be teaming up and making this program an exciting one for anyone that joins us. Um, oh, and now my slide has stuck. That's not good. Let's try this. Okay, so this is just a breakdown of the program in terms of how it runs across the terms. So the program's designed, as an overview, the program is designed to give you a basis of knowledge in musculoskeletal tissue biology in health first, so that you fully understand the musculoskeletal system and how it works when it's working well. And then what we do is give you an overview in various modules of how things go wrong with the musculoskeletal system in terms of disease, age, and disease related injuries and dysfunction. And then we look at how we can apply rehabilitation using multidimensional patient management strategies to improve patient outcomes. So our terms are split into three. The first term, you learn about the normal musculoskeletal tissue biology, normal form and function. You look at biomechanics and how you can apply physiotherapy to biomechanics of the human body. We look at a module called movement, science and pain. And you also do a research methodology and transferable skills module, which looks at everything from statistics to presentation skills and the skills that you'll need to everything from analysing your data through to transferring the information that you work on during your research project into the wider domain, so publication skills and so on. And then in term two, we look at the disease and dysfunction aspects of the musculoskeletal biology and look at clinical aspects of musculoskeletal medicine as well. We also look at rehabilitation along with that multi-dimensional patient management strategies and also research governance, which is pretty much critical for any research that you'll carry out in whatever field you go into. And then for me, the thing that I think is the exciting bit in term, well, it's all the exciting bit, but in term three, the research project, where you get to work with people like us and our colleagues across both the academic side and the clinical side of the hospital. So every year we put forward research projects which are involved in our active research. And those projects you become a part of, you become a part of the research team, and you work in conjunction with us, solving either a research or a clinical problem that goes across the whole of term three, and at the end of it, you produce a dissertation for that work. And we strongly encourage you to go ahead and publish that work at the end of it if you want to do so. And obviously, we're there to support you doing that. The projects range enormously in terms of their content, but they're all hopefully very, very exciting projects and things that you can really get your teeth into. And the other thing about the research projects is if you come to us with a certain background, and that background gives you a kind of a desire to work in a certain field, it's also possible for you to generate your own research project with us. So you come to us and we can do that in conjunction with you and find the best people to support and supervise your project so that you can leave us with a project that's of your own design if you want to. So that's a kind of overview of the program in its entirety. Some of these slides I'm going to skip through quite quickly because some of it to me seems fairly obvious. The idea of this program is it's a higher education qualification. And what we want to do is to provide you with the skills and the knowledge that you need to go forwards and conduct research, whether it's academic or clinical research in a professional environment going forwards. So one of the things that's important for this program is that you don't need to have a physiotherapy background. You can come from a basic science background, for example. But what we're trying to do is hone your skills so that you are able to critically think for yourselves, so that you are able to use what you learn as a foundation for your future going forwards in whatever field you choose to go into. So that's the main aim for us. We look at the sort of cognitive domain of how we learn and how we transfer information. And to a certain extent, remembering is one of the foundation skills. But during the program, what we try to get you to do is take that learning and develop it into a full understanding. For me, understanding is being able to not only digest it yourself, but be able to regurgitate it for somebody else to understand. And so that's what we try to establish for you, that you're able to understand it to a point where you can explain it to another person. You can then apply that understanding and knowledge to a clinical or an academic problem, and you can obtain and analyze data, evaluating it in terms of what it actually means, and then creating from it. So creating a new direction of research that will advance treatment for patients or for research fields in the future. So this just goes back through that sort of scale of learning. Can you recall the information? Do you understand it? Can you apply it? Can you analyze and evaluate it? And then can you create things from it? So every research question generates a new question when you answer it. And that's fundamental to learning. And in this program, we encourage that, and we encourage you to develop your own questions so that you can take your learning forwards in the future. We like to know that you have demonstrated these things throughout the course of the program that we run. It's developing a systematic knowledge and understanding of the learning materials that we're providing, and using that in the application of your knowledge for your research projects. So essentially what you're doing is layers of learning throughout the first 2 terms, and then using your project to really test whether or not that learning is instilled to a point that you can analyze and interpret your data and carry it forward with further questions. I'm this slide I'm going to skip forwards over. The only thing I will say here is that it's important, the research methodologies and the research governance modules which you do on this program are really key modules, because, as I said earlier, they are fundamental to all research, whether it's as an academic, which is the hat I wear every day, or whether it's in a clinical environment in which Sharon finds herself more involved with on a day-to-day basis, or whether it's in the sort of hybrid between the two, which is where we work when we collaborate on research projects, hopefully with you guys going forwards in our program. We work as part of the UCL's connected curriculum framework. Researchers are the lecturers that you have for all of your lecturers are active researchers. So whether it's on a clinical basis or whether it's on an academic basis, we are all doing active research on a day-to-day basis. You do research modules throughout your time with us, and you do longitudinal, we provide longitudinal teaching. So some modules will run alongside one another throughout the first term, and you may well have assessments which take place at either mid or throughout the course of the term, or at the end of the term through a sort of longitudinal teaching program. You will have the opportunity to interact with clinicians. We work very closely with the clinicians at Stanmore. One of the things that makes, in my opinion, makes us a very special place to work is that the academics in our department work really closely with the clinicians across the hospital to try to overcome complex orthopedic and neurological problems for which patients have been referred to the Royal National Orthopaedic Hospital for treatment for. And so we work closely with them, and we encourage you to as well, and get really involved from the outset. A lot of those clinicians come along to our induction week in September, and we really encourage you just to go along, say hello, introduce yourselves, and get involved from an early stage. They're always very welcoming, both from an academic standpoint, but also from a clinical standpoint, and where there's opportunity for you to attend clinics and go on to wards. A lot of our clinicians are very happy for you to do that, and will work very closely with you in order to help you establish your work throughout the programme, and then also to obtain your dissertation at the end. Assessments, which everybody worries about, and I try and encourage people not to worry about assessments, but they're designed to be authentic and varied. So we no longer do a single type assessment. We don't try and give you endless essays. We try to vary it a lot. I'll talk a little bit more about that in a minute, but we try to let you play to your strengths. So we specifically design our assessments so that, irrespective of what your strength is, whether it's in written work or in presentation skills or in analysing data and critical thinking, that you get an opportunity to showcase that through our assessments. So you really get lots of different ways to be able to show us that you understand and can apply the knowledge that you've learned throughout the course of our programme. We do joint modules with other programs. So at Stanmore, we also run two other master's programs, and all of the students are combined on the induction week. Again, we encourage you all to get together to get to know one another. You'll do lots of modules together with combined learning and modules separately, but often you'll find that the programs do complement one another, and it's always useful when you're coming to doing your projects and your dissertations to actually share information, because working together always helps you. It's always better than, well, two heads are always better than one. So we encourage you to work closely with the other program students as well. Your teaching sessions, you will have obviously sort of normal lectures, face-to-face lectures. There will be also interactive lectures where you'll be working with the lecturer, with expecting a sort of two-way street. We do flip lectures and online lectures. There are tutorials to supplement your learning. And we also do working group sessions where we split you into groups and encourage you to work as part of a collective. And there are lots of practical sessions to become involved with as well. As I said, in the assessment, it's part of the learning process, so we try to encourage you not to worry about it. We try to make the assessments authentic, so that they are essentially skills that you will be able to apply in whatever future career you go into. So, for example, if it's a written piece of work, it would apply to something like grant writing in the future. We don't tend to get you to write just for the sake of it. There is a process which is helping you learn the skills that you'll need going forwards. And we encourage you to build on the skills that you've learned throughout the course. So we start off with certain skill sets in terms of our assessments, for example, essay writing, and then we build on those throughout. And at the end, towards the second term, you'll look at writing things like grant proposals and potentially how you apply for ethics and so on. The deadlines for assessment, I'm sorry we have to say this, but they are important. It's all done by electronic submission, and deadlines are key. So you are made aware of all your deadlines long before they come. You can always reach out to us if you're having any issues or problems, but please do try to stay to deadlines. And plagiarism is something that is key in our department. We are all about academic integrity, and we encourage you to use what is available to you in your learning in order to produce a piece of work directly from you. So that's what the key thing is here. Our marking scales are pretty simple. Anything above a 70 is a distinction, 60 to 69 a merit, 50 to 59 a pass, and below 50 is a fail. As I say, it's here for the information, but we try to encourage you not to worry too much about the assessment process until you come to us, and hopefully by then we will alleviate your worries as you go through, because you'll know what you're doing by the time you get there. For us, feedback is really, really important, and not just in on a one-way street. So feedback from us to you happens in the form of annotated coursework, feedback sheets which we provide you, and also feedback sessions at the end of modules. The opportunity to ask questions all the way through. As I say, all the lecturers are available on campus or within the UCL community. So you can come to us, email us, if you want feedback from us that's more specific to something that you're interested in, we can do that for you. So that's in our direction to you. But we also encourage feedback the other way with continuous module dialogue, which is asking you to continually feedback throughout your learning during your modules, to let us know what you think is the good, the bad, and the ugly, so that we can let you know what we're doing about those things if you have any issues or things that you think that can be done better. We also have student representatives for each program. These students are, I think there are a couple of slides on this in a minute, but the students are elected in early October, and then those students come to regular meetings with divisional representatives to give feedback. So you, if you are a student representative, are essentially the microphone for your student cohort. So you will gather information from your peers and present that in those meetings to try to encourage change and productive change in terms of everything from teaching progress through to where you get lunch. So, we're always interested in your feedback, and they come through the staff student meetings. As I say, they're appointed in early October, and those meetings, it's not an arduous role. I think they're about 3 or 4 a year, but it does give you a choice, an opportunity to be a voice for your student cohort. So I strongly encourage you to do it if you join us on this program. There's a lot of support available through UCL. We realise that obviously I've talked about deadlines. Sometimes they can't be missed so they can't avoid being missed for various reasons. So everything from short-term illness to extenuating circumstances. Our handbook, if you look on our program page, gives you links to all of the UCL support framework, and there are always reasonable adjustments that can be made to accommodate all of these things. So I encourage you not to worry about it. Just keep us informed of everything as we go along. We all have sort of open office door policy, so come and see us. What do we expect from you? As I've sort of hopefully given you a kind of speedy overview of what we're going to be delivering to you. What we expect from you is to actively participate. So hopefully you don't think that we're all ogres. You'll come and see us, knock on our doors, talk about research, talk about your studies. In terms of what you're doing in the wings, we expect you to do background research for yourself. We've got an excellent library both on campus, and UCL libraries are an amazing facility, so we encourage you to use them. Read around the subject. The more you read, the more you know, the more interesting it becomes. Get involved with the group work and the discussions. Come join in, be part of the team. We work together very closely, and it's really good to be part of that teamwork. We provide the support that we all need, both in both directions, both you for us and us for you, to work well together. And we also ask you to participate in the continuous module dialogue, because it's all very well for us to continue to teach you in certain ways, but if the message isn't getting across or you have any problems with that, we need to know about it so that we can do something about it. And the sooner you let us know, the better. So it's really good if you can participate in that. So that's a bit of an overview of our program. I realise I've been chattering away for ages and ages. I'll leave that up here and open the floor to ask Sharon just to say a couple of words at the end of that. I said, if there's anything I've missed. But otherwise, I realise there's nobody currently in this session, but I will put our email addresses online for you to be able to contact us if you want to, and you're always welcome to try and arrange to come and see us if you'd rather meet us face to face.
Thanks, Catherine. This was lovely. Just to add to Catherine's presentation, which was quite comprehensive, is that actually we're looking to do, the main reason is that we want to obviously have this program ultimately impact different practices, and make research and clinical practice better in the future, when you all go back to working in this sort of wider community. So we try to always have that hat on where we think about how is this going to really impact practice. And that's why when your dissertations come up, in this term three, I think it's important that you're sitting obviously with academics, clinicians, you're sort of working out what problem you're trying to solve and how does it impact. And these skills are transferable to other projects in future and also other problems you're going to try to solve. So it's quite a comprehensive program.
Yes, I'm sorry. I think I've probably lost the wood for the trees with that. And that's absolutely right. It is about what we can all do going forwards to translate it, translational, research, translational solutions to the problems that we're faced with musculoskeletal healthcare. So brilliant. So I will stop sharing my screen and I will just pop onto the chat here and pop our um, email addresses in here. Sharon, are you able to type yours in there as well?
Yeah, I will do.
And then I think they will be shared with you. So if at any point you have any questions or you are interested in the program and want to reach out to us, just drop us an email. As I say, we're happy to answer any questions that you might have, or also happy if you wanted to come and see us at STEM or pop in, say hello. You might be able to meet some of this year's student cohort who will be able to tell you what's already going on in the department, and hopefully we'll get to meet some people who've looked at this online next year, next September.
Yeah, it would be great to see some people. And any questions, every question is important. So please get in touch with us if you have any questions.
Brilliant.